Hello, I'm Wendy Wilson, and I'd like to welcome you to another edition of Realizing Potential. Today I have with me in the studio a dear friend and a dear colleague. We've worked together at Darton State College and now Albany State University for quite some time. Have always been impressed with her level of professionalism and just her focus and the pride that she takes in the area that she is responsible for. She is none other than Dr. Sarah Brinson. I love that doctor part. I love it.
Me too.
Yeah.
Dr. Wilson.
Yes. How are you today?
I'm very well.
Good.
How about you?
I'm doing good. Just coming off this roller coaster that we've been on. But
graduation, end of the semester. But all is well. All is well at Albany State.
Good. Indeed it is. Indeed. Tell the viewers a little bit about your background, where you did your undergraduate, graduate work, and what your areas of study were.
I have a very interesting background, Wendy, because I actually started out at Darton State
know
University.
that. Okay.
I did.
Okay.
I actually graduated from the physical therapy assistant program at Darton State in 1997.
Wow.
It's the second year that the program had been in existence.
Okay.
Yeah. So I started out there, did a little bit of undergrad from Valdosta State before I decided what I wanted to be when I grew up.
Okay.
As you know.
I know.
That path has been ever changing.
Still figuring it out someday.
Did that, worked in the hospital Palmyra for years. I was there for about 9 years before I was approached by the program director of the physical therapy assistant program to possibly come on as the clinical coordinator for the program.
Wow.
So after much agonizing, because I love the clinic, I love my patients, I love giving back, I decided to come on.
Okay.
So I was at Darton, been at Darton since 2004.
Interesting. I had no idea. Okay, very good. And I could see why you probably did not want to leave the clinic. You have a outstanding personality, and that's an area where I'm sure there's a lot of fear and pain that's involved, and so you want that practitioner that's engaged and kind of helping you walk through it
I
step by
actually
step.
missed it so much that about 5 years ago I started back PRN on the weekends.
Okay.
And I work every once in a while on a
Okay.
Saturday or a Sunday.
Oh, interesting.
So I really think it helps a lot because it helps me bring back those situations to the classroom.
Okay.
And I can apply it with the students.
That makes sense. That makes sense. Well, in addition to that, we can't just stop there. What else have you been doing academically?
I know. Well, once I got to Darton, I realized that there was a gap for me when it came to education and what education means, because I literally went from the clinic into the classroom.
Okay.
And sure, I was educated in everything I needed to know to teach my students that entry-level knowledge that they needed in the clinic, but I felt like I was missing that education background.
Okay.
So I continued and finished my bachelor's degree in education and my master's in education from Valdosta State, and just recently, along with you, have finished my doctoral degree in higher ed.
Very good.
So from Columbus State.
Yeah.
Very excited about that.
As you should be. As you should be.
I feel like I am the endless learner at this point.
It's all worth it. One of the
It
things that I
is.
want to that you mentioned, and then we're going to get into the PTA program, that I think it's important that particularly our students hear, is you said that you were, of course, working in your area, and then someone tapped you on the shoulder and said, hey, I think you could serve at the institution in terms of an instructor. And I say this to my kids all the time, that you never know who is watching you.
You don't. You never know who is watching. You
Yeah.
never know. And I tell my students that all the time, treat every patient the same, no matter what. You never know when you walk in that door and you're treating a patient that may be the family member of the CEO of the hospital or the family member of the mayor, and they choose not to say anything to you just to see how you're going to respond.
Right.
But they will ask you particular questions of what program did you graduate from? Where did you graduate from? Where are you from? Who is your boss?
Yeah.
So you never know.
Absolutely, absolutely. I have a god niece, and she has a similar story, Nakia Bradley, and she's an alum of Albany State University, but she's in the nursing discipline as well. And she received an opportunity that same way. This woman was really impressed with her delivery of care and attention, and so she says, I may have an opportunity. That's how she got into the health department.
That's amazing.
Yeah, so she had a stint there for a while. So that is important, again, and it's just wise or important, I think, for people just to walk away and say that someone is always watching you. And so whether the performance is good or bad, they're taking note. And they can either serve or work to your detriment in the end.
I always tell my students, treat every patient as if it was your grandmother.
Great advice.
I mean, think about that.
Great advice.
How would you want your grandmother or your mother or family member to be treated?
Absolutely, absolutely. Tell our viewers about the PTA program. What does that involve?
We have a fabulous physical therapy assistant program here at Albany State University. Like I said, it has been here since 1996. It started. In order to get into our program, there are prerequisite classes that you have to take, which are your basic classes, math, English, your history class, and then you apply to the program in order to get in. In order to get into the program, you have to have at least a 2.8 GPA. You have to do 40 hours of volunteer work in the field because we want to make sure that you understand what physical therapy is about. We don't want a student to get into our program and say, I don't like blood, or I didn't realize I was going to be that close to a patient. So we want to make sure you truly understand what it is to become a physical therapist assistant. And then we have an interview process.
Wow.
And we usually take about 20 to 24 every year. Our program starts every August.
What type of candidate are you looking for? You certainly mentioned the academic piece, the credentials that you need to have, and the volunteer persons. But I think it's, I believe, and you correct me if I'm wrong, the industry, the profession deserves a special type of person. I liken that to teachers. I think it's your your calling to do that. Absolutely, absolutely. So, what type of candidate are you looking for?
Well, it's very hard, Wendy, to move through all those applicants because usually we have anywhere from 60 to 80 applicants that apply for 24 seats. So you really start by looking at GPA, but I tell my students all the time, having a 4.0 GPA doesn't always make the best PTA student. So really we look for that well-rounded candidate. Of course, we've got to look at GPA, we've got to look at their T scores, we've got to look at their volunteer hours, but that's where the personal interview gives us a little insight as to why they have chosen this for their profession and why they want to come down this path.
Very good, very good. Tell us a few, I know you're knowledgeable about several of the other programs, and we have a very impressive health, isn't that amazing? Careers.
Health careers, health professions. We have changed that name so many times.
Well, thank you for giving me
over the past couple of years. I mean, we have. When you and I first started at Darton years ago, we were Allied Health.
Allied Health. I still want to call it that.
And then we've moved to health sciences, and we moved to health professions. So it's health. Health.
There, let's work with that. Tell us a little, some other areas that students might be interested in pursuing.
We actually have 13 career programs within the Health Science Division, and we have 5 or 6 certificate programs. So we have every aspect that you can think of. We have respiratory care, we have diagnostic medical sonography, we have radiology, occupational therapy, health information technology, emergency medical services, histotechnology, and dental hygiene.
Wow, wow.
And all of that aside of nursing.
How did we miss that one? Absolutely. That's an extensive portfolio. One of the things I want you to help dispel, and I run across a lot of students, and they immediately, and they look at it from the aspect of convenience, because I know a lot of people are working, and they have families, and so they're like, I'm going to get involved in an online program. So tell our viewers which of the programs that you mentioned have an online component, And also let them know that it comes with, it's unique. It's not as easy as one might think. Right.
All of our health science programs are very competitive.
Okay.
They are all 2-year programs, so they work great for non-traditional learners coming in, working a full-time job. Some of our programs, well, all of our programs, you can get all of your prerequisite classes online.
Okay.
That's a very easy component. But once you apply to our programs, several of them do have in-class, face-to-face components, labs, activities that you have to do hands-on just because we're dealing with patient care. Our 2 programs that are fully, completely online are health information technology. We have a coding certificate that is completely online, and then we have a medical lab technology program also that is completely online.
Okay, very good.
So there are several online options.
Okay, excellent.
But other programs too have different hours. They may have night hours or weekend hours so that if you're working full-time, you can fit that in. We have several different tracks in some of our programs.
So we certainly make it convenient.
We do.
Right.
We do.
Right. We know that a lot of times, one of the things that I've always been impressed with is you all kind of help to navigate students. So oftentimes, and I know I approached college the same way. I started off, I want to be an accountant, and I think I made it up to intermediate, and I knew that was not my destiny. Yeah, just took a level of discipline that I just did not have. I still stayed in the business field, but the point that I'm trying to make is that you all are very good. A lot of people show up at the door and say, hey, I want to be a nurse.
Right.
Yeah.
Right.
Everybody's not called to do that. And
No.
and that's a good thing for several different reasons. But what I've always been impressed with is you all kind of help to navigate them along the way. So no, you did not make the cut, if you will, for this, but we do have some other healthcare professions.
Right.
So having said that, let's educate our potential students a little bit in terms of what it is that you all are looking for, particularly out of any of the disciplines. Specifically the core classes. What do you need to be good at?
Definitely science.
Okay.
Almost all of our health career programs require anatomy and physiology 1 and 2. So that we started this year actually working with our professional advisors and coming up with a group of classes that the students could take the very first semester universally to see, and those are English 1101, Anatomy and Physiology 1, your American Government, your ASU 1101, and then your Humanities course.
Okay.
And really we decided to put them in that Anatomy and Physiology 1 to let them see, hey, all these career fields are heavily science-based. We've got to have this class. If they're not interested in anatomy and physiology, that might be their first sign that, hey, we might need to think about something else.
Absolutely. And so let's identify that early on.
Right.
Yeah, that's great. That's great. That's one of the things that I've always been impressed with. Yeah.
We definitely want to try to put them on a path to success. And no, every student is not cut out to be a nurse. I am not. You know, every student may not be cut out to be a PTA. But if you know in the back of your mind that you do want to do something with health and helping people, we can try to help find the best fit for you.
Okay. You didn't want me to ask anything personal. You were like, don't ask that. But I am going to ask you this, and I know you will be able to answer it quickly. So what was it about PTA that you initially knew, or was that moment that you had? You said, this is a field that I want to pursue.
I really decided very early on. You know, I know you and I have taken an education path that has lasted a very long time, which I'm really actually excited about because we have taught our children that you are never too old to continue your education. And I really like the path that I have been on. But very early on, when I was actually in middle school, I was in an Explo program, and we did a tour of a hospital and healthcare career fields. And we actually went and spent a week in different sites all around the county in which I lived. And I ended up spending about 2 days with a physical therapist. And that was it for me.
Really?
I think it was in 7th or 8th grade. That was it.
Wow.
I knew.
Interesting. Interesting. Well, again, I often brag about you to you, and then in different company as well. One of the things that have been impressed with, and it's been evident, and this, we've come full circle with this conversation, is that people are always watching you, and your focus and your drive that you bring to anything that you do, and that is one of the reasons, I'm sure, why you were also tapped, because you probably don't want me to say this, but I'm going to say it anyway, to serve as I want to give you a new title every time, assistant.
Interim.
Okay, I know you want to stress
Vice
that.
President of Academic Affairs. Right. And that is a humongous honor for me.
Yes. Well deserved, though.
Very, very excited to serve in that role, to try to help this university move forward. We've got some great things to offer our students.
Indeed. But I'm going to still brag a little bit more. But again, it goes back to what people saw. And so in addition to your ability to offer stellar instruction, as they said, that we see some skill sets that fall into the leadership realm, and you've stepped up to the plate, and we're still dealing with this, the reeling from the consolidation, but have no fear. We will right the ship, and that's what it was designed to. And I do want to stress, as we wrap up this year, that I've spoken to, as I'm sure you have, other institutions, sister institutions and colleagues that work there that have also gone through the consolidation. And it is not an overnight process. And I think many people approach, and then those looking on the outside thinking, oh, you're still dealing with a lot of things. We are, but that's what the whole process entails, that you almost kind of go through a forensic examination, if you will.
And we're learning. We're learning together.
Absolutely.
We're learning how to live together. We are. And that's okay.
It is. Some growing pains. But again, everyone is still very excited, and rightfully so, about the direction that I know we will go in. And I'm excited about what your future entails, and just so honored that you, again, just have that, because your passion for it is very contagious. And so you're always going to say, yeah, but then how can we move in this direction, or how can we fix it? And let's not lose sight as to why we're here, which is to educate these outstanding students.
And I think if anyone was at the graduation ceremony on Saturday, just to see the path of all of our students, we had from certificate all the way to master's degree students. And what an honor to be able to say, as a university, we provide an option for everyone student.
Right? The portfolio is that broad. Right.
We have an amazing opportunity.
Right. And then the growth, it's almost like that one-stop shop. Right. You can start here in this one area and then go all the way up absolutely to graduate programs. So yes, great things at Albany State University. Let me just say congratulations again.
Thank you so much. Yeah. And congratulations to you.
Thank you. It's indeed been a journey, but I know well worth it. And again, a lesson that education and learning is a lifelong pursuit. It's never ending,
it's a lifelong
as it should be. Right.
It is.
Right.
I
Those
totally
that you
agree.
serve deserve that.
And I think if we're going to demand that level of excellence from our students, we need to follow that path.
We need to demonstrate that. Well, I can't think of a better way to end this conversation. But the PTA program, physical therapy assistant. Again, tell the viewers again, if they're interested, and hopefully there's some out there, what the enrollment process is, and then are there any deadlines?
Right. So if you're interested in the physical therapy assistant program, first they need to apply to Albany State University. We have professional advisors that will take over in that first 45 hours and help take over. It's really 23 that they need for the prerequisite classes for the program.
Okay.
Once they finish their prerequisite classes for the program, they apply. They do an application for the program. It's a totally separate application. It's free.
Okay.
There's no charge with it. And it is due on June the 1st.
Okay.
We interview all of our candidates. We accept the class, and our program starts once a year, every August, with the fall semester.
Outstanding. So it's certainly they're in the great window,
right,
to get that application prepared and then submitted and start the journey.
That's right.
Right. Dr. Sarah Brinson, it was a pleasure having you on the show today.
Thank you, Dr. Wilson.
You're welcome. We'll chat a little bit later. Have a great wrap up the semester. Well deserved rest coming your way, and then we'll kick things off again in January.
Sounds great.
Sounds like
I'd love to come back.
Wonderful.
Thank you.
Viewers, thank you so much for joining me for this edition of Realizing Potential. I'm Wendy Wilson, and I will see you next time.